Hi, I'm Debra Rickwood, a Professor of Psychology at the University of Canberra and Chief Scientific Advisor for Headspace, the National Youth Mental Health Foundation. I've spent my career using my research skills to develop and design and provide information around designing more responsive mental health services. My interest and my passion in this field came from struggling through my own teen years with my own mental health problems and also seeing the struggles of my friends around me, including many close friends who suicided at that time. So since then, I've been really interested in understanding how we can better help young people get through that time of life and how we can create mental health services and mental health interventions that really meet the needs of people when they're struggling at different times of life. Mental health is one of the biggest challenges that's facing society today, and it's a challenge that's growing. Most of you will have heard the statistic that 1 in 4 young people will experience a mental health problem each year. This is about 1 in 5 for older people, but by about the age of 21, half of all young people will have experienced a clinically diagnosable mental health problem. You can see from the graph here around the burden of disease, the yellow part of the graph are mental disorders. So from about puberty through the teenage years and into early and middle adulthood, it is mental health that is the health issue that people are struggling with. So we really need to design mental health services that meet the needs of people in this age range and can help to better address these issues. My PhD research was some of the first to look at what the barriers were and the help-seeking pathways for young people in terms of accessing mental health interventions. Through that research, we've learned that during the teenage years, both boys and girls naturally drop off seeking help from their family. They also drop off seeking help from professional services. Girls compensate for this by seeking help from their friends, which isn't always a good thing to do because girls can get together and amplify each other's distress. But boys increasingly turn to no one but themselves, which is one of the reasons that boys have one of the highest suicide rates. We know now that some of the key barriers to seeking mental health care include things like stigma, so worrying that what other people will think about you if you have a mental health problem and if you seek treatment. Having a lack of a perceived need for help, so normalising things that you might be able to do something about with appropriate care. What we call help negation, but many of the mental health problems that there are and the pessimism, the withdrawal that goes with them actually makes people move away from seeking help. Poor mental health literacy means not having a good understanding of mental health problems, beliefs about what you can do and where to seek help. And most of us also like to be self-reliant. We like to look after ourselves and if anything just turn to our family. But these things all act as barriers to seeking professional health care. The facilitators to seeking professional health care include having a social environment that encourages you to do so, having had a positive past experience of seeking help, having availability and access to services that are focused on the needs of the people seeking help, and most importantly, hope. And that's having a positive expectation that if you do seek treatment, that it's going to do something for you. For the past 8 years, I've headed up research and evaluation for Headspace, and Australia is a nation that's ahead of the world in rolling out mental health services for people aged 12 to 25. I have been involved in the initiative from the very beginning, and I set up the Headspace Centre in Canberra, of which I'm very proud, and I knew at the time that this was a critical need for the Canberra community. My role here at Headspace has enabled me to do a whole range of research for us to better understand how to meet the mental health needs of young people, including how to work with young people who are having suicidal thoughts and better reach out for them. This research and my research interests have led more recently for me doing some research with Lifeline. which is another very important Australian service at the forefront of mental health services. I'm very excited. In the next 5 years, I've just won a large 5-year grant to work with Lifeline to develop their services. In this, we've got 3 phases. We're going to be looking at what the community wants from Lifeline. We're going to be using machine intelligence to be able to identify the needs of people calling Lifeline and getting them to the right services. One more thing to say. And we're going to see whether we're achieving outcomes, again using innovations in machine intelligence, putting research into action for better services. Thank you.